Hi, my name is Sydney and I am a nurse. How can I help you today?
Hi, I've been having trouble with repeated episodes of headaches and dizziness. I also feel really tired and I feel like my heart's beating really fast.
Okay, let's take a look at your blood pressure. So the average reading of blood pressure is 120/80, but yours is a little bit high at 160/100. I noticed some flushing on your face. Have you had any caffeinated drinks or cigarettes prior to this appointment? Or did you do some exercise before coming to this appointment?
No, I haven't had any caffeine, cigarettes, or I haven't exercised much. I do smoke and I enjoy drinking coffee, but I don't drink any alcohol.
Okay, so let's explore further into your health issues. What can you tell me about your dietary habits and your activities?
My diet is pretty poor. I eat a lot of fast food because I don't know how to cook. My husband used to cook, but he's gone now. I also don't go out that much because I have arthritis. I usually stay at home and watch TV.
I see. I'll come back in 5 minutes to retake your blood pressure to confirm my findings. Okay, so your blood pressure is still reading at 160/100, so the doctor has ordered a lab work for you to be completed. Let's take some blood today and I will have you come back in 2 weeks' time.
Okay.
So let's take a look at our assessment data. Mrs. Wong is a widowed 66-year-old woman. She's 5'3", weighs 165 pounds, and her BMI is 29.2. Her blood pressure on multiple readings was 160/100 and her heart rate was 102. She reports low activity level and poor dietary habits. She is a smoker and enjoys drinking coffee but consumes no alcohol. So, with the information that we have gathered from our assessment, it is safe to say that Mrs. Wong is in a risk for developing serious cardiovascular diseases if her hypertension remains untreated. Therefore, my nursing diagnosis for Mrs. Wong would be deficient knowledge related to hypertension, antihypertensive drug therapy, and non-drug lifestyle changes. Because Mrs. Wong lacks the knowledge about hypertension, I would need to plan some education around her condition as well as healthy lifestyle changes. Mrs. Wong, you have hypertension.
What is hypertension?
Hypertension is a condition used to describe persistently high blood pressure. Normally, blood pressure reading is in the range of 100/80 millimeters of mercury. The first number describes a systolic pressure, which is the pressure exerted on your arteries when your heart muscle contracts. The second number is a diastolic pressure, and it refers to the pressure in the arteries when the heart muscle relaxes between each heartbeat. Untreated hypertension increases the risks for heart attack and strokes because your heart is pumping extra hard to circulate blood into your system. So, the doctor has ordered you a type of diuretic drug called hydrochlorothiazide. What this drug does is that it inhibits the absorption of sodium in the distal tubule of your kidneys, and it increases sodium and water excretion, and it helps to decrease blood volume and decrease your blood pressure. So, take this drug, 1 tablet once a day, preferably in the morning, and you can take it with food to minimize gastric irritation. If you miss a dose, you can take it as soon as possible, but not right before the next dose is due. So, do you have any questions for me?
Yes. What are the side effects of the medication?
Side effects of this drug includes dizziness, drowsiness, hypokalemia, and hyperuricemia. We'll also be doing lab works to check your electrolytes and to monitor and ensure that your electrolytes and kidneys are functioning while you are on this medication, and to ensure that you are not experiencing any critical side effects. So, Mrs. Wong, this pamphlet has recipes for simple meals you can make at home, and I'll also refer you to our dietitian to help you get organized at home with regards to cooking.
Sounds good.
So, I will see you in 2 weeks' time to measure your blood pressure again. Hopefully, with the new medication regimen and diet and exercise routine incorporated, we can aim to decrease your blood pressure.
I sure hope so.